Hello everyone, welcome to Pediatrics by Dr. Anand. Is my voice audible to everyone? Please put a message in the comment section. Yes or no? Is my voice coming? Yes or no? There was a that link was not working. So now it's working. Please let me know. Is my voice audible to everyone? Hello everyone. Hello amazing people. You guys are so amazing and everyone is so क्या बोलते हैं उसको so nice and so kind of helping hand we have. Great. I hope my voice is coming. Okay, let's start this amazing class. Okay. Good evening everyone, my name is Dr. Anand. Today's topic of choice is cardiology, and most importantly, today is the last topic of the cardiology, and today's topic is very importantly rheumatic heart disease. Beautiful people, hello everyone. वो क्या हो गया था पता नहीं, वो link काम नहीं कर रहा था. There's a way of putting it actually, the stream key, and there are a lot of tamjam, and that link was not working, so I had to create a new link. Before starting any amazing segment, my name is Dr. Anand. I'm MD Pediatrics, and I've done my MD from TMU and MBBS from Bangalore. And our goal is to teach beautifully to every single person on this planet who is interested in pediatrics. Okay, great. Let's start this beautiful class, guys. And again, before starting any amazing segment, we always have a motivating quote. And today's $1,000,000 quote is what? You cannot see your reflection in boiling water. You cannot see your reflection in boiling water. So neither you can see the truth when you are angry. Such a beautiful line, guys. Can we please appreciate this line again? This million dollar line says, number one, that you cannot see your reflection in boiling water, neither you can see the truth when you are angry. So that's the moral of the story I want you guys to understand. Okay, yes, hello Dr. Karan, hello Dr. Suman, Shubhangi, Lalit, Priya, Amrit, Indian lovers, and so many amazing people. So do you agree with this line, brother and sisters? So basically, and what is the moral of the story? I'll repeat again. Take deep breaths. You cannot see your reflection in boiling water, neither you can see the truth when you are angry. The moral of the story is that calmness is the key. Have the peace of mind, most importantly. And remember, no one makes you angry. You use anger as a response by yourself. Have you heard this quote somewhere? That actually it's a very thoughtful quote. No one makes you angry. Okay, no one makes you angry. You use anger as a core, as a response by yourself. So the moral of the story is just be amazing and just be happy. Life is just one. Today's topic of choice is nothing but, very importantly, rheumatic heart disease. Rheumatic heart disease, that is the last topic of cardiology. Congratulations for winning, for what you called finishing with me cardiology on a PhD level. For all those newcomers and old comers, remember, this is for the PG, UG, and DM students also, this whole cardiology series, because the level of cardiology which we have discussed is insanely amazing. Rheumatic heart disease, can you please tell me this beautiful answer, that rheumatic heart disease is the sequelae of anyone? Yes, rheumatic heart disease, the sequelae of acute rheumatic fever. I think we all know about it. Again, discuss with me. You are amazing. Okay, you are beautiful, you are amazing, you are just perfect. Just tell yourself and just enjoy. Okay, point number one, what did we study? Rheumatic heart disease is a sequelae of acute rheumatic fever. Obviously, acute rheumatic fever patient will have a mitral valve involvement, and that will lead to a rheumatic heart disease. Question, yeah, again, a very cute question. Which valve is the most commonly? Yes, very well put. Which valve is the most commonly valve? Anyone answer in the comment section, please? Which valve is the most commonly valve? Yes. Yeah, very good, very good. So yes, yeah, I think you all are amazingly answering. Yes, very good. See, we have so many people who are answering. Yes, live class. Yeah, exactly. So the mat is the mnemonic, very importantly, as you all know. And yes, what you called perfectly, we have the mitral valve involvement. Number one, very importantly, mitral. Yes, the patient will have a mitral regurgitation, or the patient can have a aortic regurgitation, or the patient can have a tricuspid regurgitation, right? These three regurgitations I want you guys to remember, but the mitral one is the most important one. Okay, that you should know. Very importantly, mitral regurgitation. Now listen very carefully. Now I want you to rock. Okay, I want you to rock. Okay, most importantly, remember one thing, that mitral regurgitation, can we have some quick points pertaining to mitral regurgitation? Yes, exactly. So mitral regurgitation, one point I want you to remember is point number one, like the hemodynamics. Now you have to be with me. Hello, yeah, just be with me, just try to understand the concept. Mitral regurgitation. In a case of rheumatic heart disease, mitral valve obviously is the most common valve involved, and there is mitral regurgitation. Now let's talk about it. As you all know, in all our classes we discuss. Okay, it's not that I'm teaching. Okay, it's just we'll discuss, and be amazing. Mitral regurgitation leads to what? Can I say my, listen very carefully. Now you be connect, spiritually connect with me, okay? Mitral regurgitation, number one, it leads to leak of the blood in the left atrium. Do you agree? Quickly tell me yes or no. Do you agree with this point that mitral, yeah, exactly. So mitral regurgitation, very importantly, yes, it will lead to leak of the blood in the left atrium. Now I have a question. I have a doubt. I am an MBBS student. I have a doubt. This back leak in the mitral regurgitation, does it happen in systole or does it happen in diastole? Yes, can you please answer in the comment section, please? What do you think? कब होता है ये, सिस्टोल में होता है या डायस्टोल में होता है? कैन डॉक्टर शुभम, मनीषा, भावना, स्वराज, yes exactly. So it happens in ये जो backflow है, the mitral regurg into the left atrium, it will happen in systole or a diastole. So I think everyone agree with me. Dr. Amrit, brother, it happens in systole. No, see, the left ventricle will contract, then only the blood will push to the left atrium, right? Are you understanding? In a case of mitral regurg, naturally, when there will be a systole, are you understanding? When there will be a contraction, systole is the contraction and diastole is the relaxation, right? So, in a case of mitral regurgitation, it happens basically like in pertaining to the left ventricle. If I focus on the left ventricle and ask you the question, I think you're focusing on the left atrium, but I want you guys to focus on the left ventricle. If I'm focusing on the left ventricle and I'm planning to have a mitral regurg, so it will happen in systole, obviously. Yes, very good. So so what happens in diastole then? In the case of systole, the blood went into the left atrium, है ना? Back into the into the left atrium by the mitral regurg. What happens in the diastole? Can I say that blood can pass freely across the mitral wall in a case of diastole? Obviously. Do you agree with me, my dear friends? Yes or no? Hanji. In a case of systole, in the mitral regurgitation, the blood was jumping back into the left atrium, whereas in a case of diastole, blood can pass freely across the mitral valve. Right? Okay. Okay. Perfect. Also at the same time, now listen very carefully, connect with me. Let me revise again. Let's revise again, okay? Because I want to literally, because it's like it's cardiology is like maths, okay? If you know step 1 and step 2 and step 3, then only you know step 4. You can never jump directly to step 4. You need to know step 1, step 2 and step 3. Okay, I will, because we have a lot of new people who have just now joined, so I'll just quickly tell again. We were discussing rheumatic heart disease, which is nothing but it is a sequelae of acute rheumatic fever. Then also we understood that in the rheumatic heart disease, the most commonly valve involved was the mitral, which is basically we have to speak about mitral regurgitation, followed by aortic regurgitation, and followed by tricuspid regurgitation. But as what you call mitral valve is the most commonly valve involved in a case of rheumatic heart disease, so mitral regurgitation has to be at the topic of choice for today. In a case of mitral regurgitation, hemodynamics, yes, exactly. Yeah, yeah. In a case of hemodynamics of mitral regurgitation, please read this line. बड़ी मुश्किल से मैंने शब्दों को बहुत तोड़ तोड़ के समझाया है. I have literally broken down every single word to teach you in a simplest manner. Just connect with me spiritually and mentally, okay? Mitral regurgitation leads to leak of the blood in the left atrium, obviously, right? Next, I asked you this question, this leak of the blood into the left atrium happens in systole or diastole, then you only told me that systole, when the left ventricle will systole, will contract, then only because of my, normally the blood from the left ventricle goes to the aorta, but in a case of mitral regurgitation, can I say that half of the blood goes to the aorta and half of the blood goes back to the left atrium? Because there's mitral regurgitation, है ना? I hope you are able to understand. Okay, beautiful, very good, very good. Okay, yes. Also at the same time, I ask you, during systole, you told me that half of the blood will jump to left atrium and half of the blood will go to the aorta. I ask you, what will happen in the diastole? In the diastole, as we can understand, the blood can quietly again come back. You know, the blood can freely pass across the mitral valve. Obviously, Hanji sir, that's very well put. Thus, although the left atrial pressure increases during systole, it drops during diastole. Can I say this line? Are you connecting with this line? Because already left atrium is doing the work to push the blood into the left ventricle, but can I say now left atrium has a extra work to do? Why extra work? Because of the mitral regurge, some of the blood again going back to the left atrium. So can I say left atrial pressure increases? Are you agreeing with me? Because normally left atrium pushes the blood into the left ventricle. So now left atrium has to do an extra work. First work is that the normally left atrium contracts and the blood goes to the left ventricle. But now because of the mitral regurgitation, some amount of the blood from the left ventricle has gone back again to the left atrium. So can I say that the left atrial pressure now increases during systole and drops during diastole? Do you agree with this line? Yes or no? Please let me know. Do you agree with this line? समझ में आ रहा है ब्रो मैं जो बता रहा हूँ आपको? Okay, very good. Yes. So this line I hope everyone has understood. Thus, although the left atrial pressure increases during systole, because left atria has to do double work now. One work is the normal pushing of the blood from the left atria to the left ventricle, and extra work because of the mitral regurge, the extra blood which has come back again to the left atrium, that leads to increase left atrial pressure. Okay, great. Next. Yeah. Can I say thus the mean arterial pressure remains normal or slightly raised? Slightly, are you understanding? Slight, the same story again only. The mean pressure will be slightly raised, but not very raised, because in diastole again the blood is going back to the left ventricle. So left atria, little pressure, little slightly mean arterial pressure will definitely increase. It could be normal also, slightly it increase. Okay, very good. Can I say due to all this, there is minimal increase in the pulmonary venous pressure? Such a beautiful line. I said left atrial pressure, one thing we understood, left atrial pressure, I can say slightly increased. So that only, now at the backflow in the pulmonary veins also slightly there'll be increase in the pressure, nothing but minimal. Are you understanding? So can I say this line, in a case of mitral regurgitation, there is minimal or slightly raised left atrial pressure, and also there is minimal or slightly raised pulmonary venous pressure. Has everyone understood this much? समझ में आ रहा है? हल्का प्रेशर पड़ा है तो ऊपर भी हल्का प्रेशर जाएगा. Little bit left atrium pressure has increased, so naturally pulmonary venous also little bit pressure will be increased. Okay, nice. Cute people understanding cute stuff. Okay. So due to all this, there is a slightly increase in the pulmonary venous pressure, but not pulmonary congestion. Now this part beautifully we need to understand. Yeah, are you understanding? Because there's slightly problem, not a big problem. Because if the big problem would have happened if it was a mitral stenosis. Are you understanding? The big problem would have happened if it was a mitral stenosis. Blood cannot go from the left atrium to left ventricle. So too much of left atrial pressure and the backflow, too much of pulmonary venous pressure. But in this case, some blood is going back to the from the left ventricle to the left atrium, and some blood is quietly from the left ventricle is going to the aorta. So that's why I'm saying there is minimal increase in the pulmonary venous pressure, but not pulmonary congestion, not like a very bad thing. Okay. Okay, very good. Next point. So when there is no pulmonary congestion, can I say there is no dyspnea? Can I say yes or no? Can I say when there is no pulmonary congestion, the child will not have dyspnea because of saying fast breathing or in kind of a increased pulmonary blood flow or a pulmonary congestion, someone has to have tachycardia, tachypnea, and kind of a big problem, right? Pneumonia like features. But now as there is not like too much of pulmonary congestion, so no pulmonary congestion, no dyspnea, and that's what. Okay, has everyone understanding? बड़े प्यार से हर कोई yes 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 ऐसे yes टाइप कर रहे हैं. Cute. Okay, good. I'm very happy you guys are understanding. Okay. Okay. Okay, let's okay आगे बढ़ते हैं. Okay, let's move further. Huh. So, yeah, so one thing I beautiful understood, in a case of mitral regurgitation, there is no pulmonary congestion, there is no dyspnea. Can I say unless mitral regurgitation is very severe or left ventricular myocardium is failing? Did you understand this line? Are you understanding? It's an obvious line, na? When the mitral regurg is too severe, then there'll be pulmonary congestion and dyspnea and like a congestive cardiac failure like a features. But now in the case of mitral regurg, the take-home message is that there is no pulmonary congestion, there is no dyspnea, little bit mean arterial pressure, mean left atrial pressure has slightly increased, and that's it. Okay, so that's good, very good. Next question, please. Can I say, therefore, the features of pulmonary arterial hypertension occurs unless MR mitral regurgitation is severe or the left ventricle myocardium is failing? Did you understand this line? Obviously, are you understanding? When there is too much of mitral regurgitation or too much of very, very bad thing, if it is there, then definitely left atrial pressure will very increase, then pulmonary venous congestion will very increase, and then pulmonary veins are obviously connected into the lungs, and again these people are connected into the pulmonary artery. So indirectly, that's what. Therefore, features of pulmonary arterial hypertension occurs unless mitral regurgitation is severe. But in the case of normal mitral regurgitation, you do not see pulmonary congestion, you do not see dyspnea, you do not see the features of pulmonary artery hypertension. Has everyone understood this much? Yes or yes? Yes. Tell me first. ओहो ओहो शुभम शुभम कह रहा है हाँ हाँ सिवियरिटी पे डिपेंड करता है. अच्छा अच्छा अच्छा, तू बाहर मिल, तेरे को तेरी मैं बताता हूँ सिवियरिटी. So has everyone understood? Let me know. Okay, I hope I'm trying my best to make it as conceptual as possible. Should I repeat or continue? Please let me know. Should I repeat or continue? Please let me know. Yes or yes. Okay, let's move further. Yeah, nice question. What will happen? Yes, exactly. What will happen to left atria and left ventricle size in a case of mitral regurgitation? Can you give me a random guess, please? What will happen to the size of left atrium and left ventricle if I am suffering from mitral regurgitation? Yes, very well put. Yes. So the answer for this question is naturally, as I can say, it's a congestion. So undoubtedly left atria will be enlarged and little bit left ventricle also will be enlarged. Okay, both will be enlarged in a case of mitral regurgitation. A beautiful line. Mitral regurgitation provides how many exits for the flow of the left ventricle blood? Such a beautiful question. Can you please answer me in the comment section? Mitral regurgitation, how many exits are there for mitral regurgitation? For the flow of the left ventricular blood, how many exits are there? And also there is mitral regurgitation. For the flow of the left ventricular blood, how many exits are there? Can you answer in the comment section, please? What do you think, guys? Anyone, Hanji? Hmm. Beautiful. So now can I say that there are two exits? Why, sir? Why two exits? Here, one exit obviously from the left ventricle. Can you please read this line? We have a forward exit to the aortic wall and to the systemic circulation. So naturally, one flow is in the aorta, like the normal blood from the left ventricle, and because of the mitral regurg, one flow is over the back to the left atrium. So one exit forward to the aortic wall and the second exit backward to the left atrium, right? Very good. It's this such a beautiful line, such a beautiful line. Oh, I love teaching, so nice. Like when I teach now, like I feel good because I think it's good, like कितने simple तरीके से समझाया हुआ है. I remember when I was reading, I was getting headache. Oh my God, such a difficult topic. Who will study? Are you then studying, then reading, then teaching, then incorporating, then putting in notes, then breaking them into 1,000 pieces and showing you one piece, one piece, one piece, and one piece. It's like this. Can you answer this question? Is this forward output of the blood, is this forward output enough during exertion, stress, or exercise? What do you think, guys? What do you think? The blood which is moving from the left ventricle to the aorta, if I'm suffering from mitral regurgitation, is this enough if I'm going to gym, doing biceps and triceps together for 45 minutes? Is this enough? Yes or no? यस ओसामा. ओसामा कहाँ था तू? शाम को आया नहीं, 5:15 बजे क्लास थी. तू नहीं आ रहा आजकल ओसामा, मैं नाराज हूँ तेरे से. या शुभांगी, ऑसम वाइब्स हेयर्स, टाइम का पता नहीं चलता. यस माय डियर, यस आई एग्री विथ यू. So the beautiful answer for this question is that definitely the amount of the amount of blood going from the left ventricle to the aorta is insufficient during the exertion, and that's why are we saying this? So this decrease in the systemic output will result in what? It will result in fatigue. Can I say the baby will get tired too often or too early in a case of mitral regurgitation? Is this right or is this wrong? Anyone? Yes, exactly. Okay. Thank you, Shubham. Thank you, brother. Warmer wala. Yes, bro. Thanks, brother. Yeah. So fatigue is a very beautiful point. PG entrance question number one. Which is the most commonest symptom of a significant mitral regurg? The most commonest, please remember, please write on your forehead, the most commonest symptom of a significant mitral regurgitation undoubtedly will be fatigue. बच्चा बहुत जल्दी थक जाएगा. There'll be fatigue in a case of mitral regurgitation. Exactly. Number one. Number two, what is the onset of mitral regurgitation in the case of acute rheumatic fever? Like, is there a sudden onset or a gradual onset? What do you think? This mitral regurgitation and patient having fatigue and all that. So, is this a sudden onset or a gradual onset? Like, give an open answer. It's an open answer. It's okay if you're wrong. Doesn't matter. Really doesn't matter, bro, if you're right or wrong. What matters is your participation. What matters is your participation. So, what do you think? Okay. I'm sorry, I'm having bad cough. That's why I'm having hot water. इसमें पानी गर्म नहीं ठंडा actually. Yeah. Okay, Hanji, what do you think? Actually, I'm okay. But the Nitika Parashar has a right answer. Frankly speaking, it happens suddenly. Please tell your brains, this backflow to the left atrium and forward flow to the aorta and then leading to fatigue is a very sudden problem. The onset is sudden. Okay, just remember sudden. Okay, please. Okay, the problem will be sudden and that will result in hemodynamic overload over the left ventricle. Left ventricle has to, there's a backflow in the mitral regurg and a forward exit also, but it is happening so fast. Please tell your brains that mitral wall is so small and the problem is happening so fast that very importantly, what you call it will cause overload over the left ventricle. Are you understanding? That is why you are seeing left ventricle hypertrophy. Because if from the left ventricle is the if the blood was going back in the case of mitral regurgitation, then LVH, left ventricle hypertrophy, wouldn't have happened. But the problem is so fast. Can you please tell your brains that the problem, that the onset of mitral regurgitation is so sudden, that the backflow to the regurgitation and the forward exit, and these things are happening so suddenly, that the patient will have a overload over the left ventricle, leading to left ventricle hypertrophy. That is the reason you see LVH in the case of mitral regurgitation. Otherwise, left atrial hypertrophy, obviously you will see, but you will see left ventricle hypertrophy also. Yes, exactly. Okay. Next question. Will you see the nice question. In a long standing MR, in a long standing mitral regurgitation, will you see the features of left ventricular failure? Will you see the features of left ventricular failure in a case of long standing MR? The answer will be no. The answer will be no. It's same, that the theory for that answer is same only, because the blood is going, half of the blood is going back, half of the blood is going forward, but this problem is happening so fast. That is why I am seeing left ventricular hypertrophy, and because of the half of the blood is going back and left atrium has its own normal work to do also, so that will lead to left atrial hypertrophy. So left atrial hypertrophy will takes place, left ventricular hypertrophy will takes place, even little, pulmonary venous pressure also will increase, but there will be no pulmonary venous congestion, or I would say no signs of failure. That is why, will you see the features of left ventricular failing in a case of long standing mitral regurgitation? The answer is no. Why? Because with the long standing mitral regurgitation, the left atrium increases in size. Obviously, the left atrium, the backflow is there, the left atrium increases in size to accommodate the regurgitant volume without increasing the left atrial pressure. The size increases but without increasing the pressure. Just remember one thing, that there is left atrial hypertrophy, of course, in a case of mitral regurgitation. And one more reason, that decrease in the systemic vascular resistance to help increase the blood flow. Like naturally aorta, which is the systemic vessel are we talking about? I am talking about the aorta. Do you think aorta is allowing the blood to go? Yeah, from the left ventricle, the half of the blood is nicely going to the aorta, and half of the blood going back because there is mitral regurgitation. So 100 बात की एक बात ये है, that you will not see the features of left ventricular failure in a case of mitral regurgitation. You will see left ventricular hypertrophy, you will see left atrial hypertrophy, you will see increase in the pulmonary venous pressure, yeah, but you will not see pulmonary venous congestion, you will not see dyspnea, tachycardia, cramps in the chest, and failure, and sick looking, and breathlessness, and all those crazy symptoms of left ventricle failure. You will not see that, right? Yeah, because half of the blood is going back, I agree, but half of the blood is going forward also. That is why you will not see the features of left ventricular failure in a case of mitral regurgitation. Has everyone understood this $1,000,000 line? Yes or yes, yes. Please let me know. Please let me know. You have 10 seconds to tell me, answer me. क्या ये जो तेरे मेरे दरमिया है, अनदेखी अनसुनी. Yes, the combination of these two results. Which two results? The blood going back and some blood is going front and all that. The combination of these two results gives a beautiful pulse to our amazing mitral regurgitation. I think the $1,000,000 answer is small water hammer pulse. FMG question number 7. What kind of pulse do you see in a case of mitral regurg? So the water hammer pulse is the pulse seen, exactly, yes, seen in a case of mitral regurgitation. ठीक है, समझ में आ गया? ओके, अच्छा ये बातें क्या हो रही हैं? अच्छा भाई, मुझे तो जेल में नहीं डाल देगी वहाँ की पुलिस. ठीक है. ओके. ओके. ओके, ग्रेट. करण, सुष्मिता, मोनीमला, मनीषा. Okay, great. I think everyone is beautifully understanding this topic. Let's move further. Could you please tell me what are the clinical feature, guys? What are the clinical features of mitral regurgitation? What do you think, bro? What are the features of clinical features of mitral regurg? Exactly. Yeah. Increase in the resting heart rate to maintain a adequate cardiac output. That this is such a beautiful line. Again, I tell you, like you need to remember the peculiarities, okay? Specific thing which happens in a specific condition. So resting heart rate, the baby is resting but having tachycardia. He's resting but is having tachycardia. You must think of mitral regurgitation. Increase in the resting heart rate to maintain a adequate cardiac output. You know, right? Naturally, because half of the blood is going back and half is going in the front. But body has to do a defense mechanism. Body has to get the blood right, get the proper blood, proper amount of blood. So that's why increase in the resting heart rate will there to maintain the adequate cardiac output. Features, such a beautiful line, bro. Features of left ventricular failure will be absent unless I say mitral regurgitation is very acute, is very severe, or my left ventricular myocardium is failing. Right? Okay, great. What happens to the cardiac apex? Yes. Can you please answer in the comment section? What happens to the cardiac apex? Is it downwards and outwards? Or is it outwards and downwards? Both are different, okay? Is it downwards and outwards? What do you think? What do you think, guys? Remember one thing. Yes, it is downwards and outwards, okay? Because yeah, exactly, in a case of mitral regurgitation, mitral regurg, right, and there is left ventricular hypertrophy, left atrial hypertrophy, so apex beat will be downwards and outwards in a case of mitral regurgitation. I want you guys to remember. What happens to the second heart sound? Yeah, this is a good question. So can you please tell me, what will you see a loud as to like second heart sound is because of the you all know that second heart sound is because of the closure of the pulmonary valves and aortic valves, nothing but P2 and A2. And can you please tell me normally what happens? Normally P2 closes early than A2 or A2 closes early than P2. Who will tell me? Shubham, Osama, Shubhangi, Amrit, amazing people. Yes, tell me. Yes, yes, very good, very good. Yes. So I think you all know, you already know beautiful answer, guys. Amazing, very good. So please remember the second heart sound. Yeah, the second heart sound will be wide and variable split. It will be a wide and a variable split because you know that, right? Very importantly, A2 closes early than P2. Normally, second heart sound is because of the, very importantly, second heart sound is because of the closure of the pulmonary valves and the aortic valves, as the pulmonary side, superior vena cava and inferior vena cava, has to get the blood on the right side of the heart. So pulmonary area, the pulmonary components has to do little extra work, okay? So normally aortic component closes early than the pulmonary component. Normally A2 closes early than the P2, that you remember. So now half of the blood is going back and only half of the blood is going to forward. So now, yeah, exactly, A2 will close more early than the P2. That's why it's a wide variable split. Remember, okay, it's a wide variable split because now half of the blood is going back and half only coming there. So A2 will close now more early than the P2, right? So that's what's a wide variable split. Wide variable split you see in a case of mitral regurgitation. What is the treatment? Yes, Osama. Yeah, let's finish this topic. This is the last cardiology class. We have covered like everything, and from tomorrow I'm thinking of starting CNS, actually, neurocystic sarcosis and everything. So let's see. Yes. What is the treatment, guys? Can you please tell me what's the treatment for rheumatic heart disease? Yeah. So rheumatic heart disease goes parallel for the what you call acute rheumatic fever kind of a thing. For the heart failure, like do you see left ventricular failure in a case of rheumatic heart disease? Usually we don't see that unless there is a severe mitral regurgitation, of course, or the left ventricle is failing. So the treatment for the heart failure, of course, as we have read in the acute rheumatic fever, even congestive cardiac failure treat same congestive cardiac failure also, like digitalis, digoxin, which the drug of normally which we use. And what's the drug of choice for CCF? Yes, very good. That drug of choice for CCF is nothing but furosemide. Lasix injection आता है, but the Lasix is a brand name. We can give nothing but furosemide, and then also we can think of spironolactone, which is a potassium sparing diuretic. antibiotic. So that's what. And also, can you see this? Will you give me penicillin prophylaxis? Obviously, bro. Obviously, right? Yeah, very good. Obviously, you'll give me yeah, exactly, penicillin prophylaxis. Amrit keh raha hai, Lasix is love. Yeah, that I agree with you. So L for love, L for Lasix. That's very right. Hmm. Will you give me penicillin prophylaxis? Yes, 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 yes. डॉक्टर शुभम, हाँ जी, अब आगे आ जाओ. अरे करण बड़ा अच्छा आंसर कर रहा है. करण, so proud of Karan. Karan has told us a very beautiful point. Karan just now shared the dose of digoxin. Could you please tell me what was the dose of digoxin in a child? 0.04 to 0.06 mg per kg. That shows that Karan is a very good student. Very good, Karan. Very good. Really proud of you. Very good, Karan. Yes. So that's right. So क्या कहते हैं 0.04 to 0.06 mg per kg. That's the right answer for digoxin का dose in a child. In a child. Otherwise it varies. And yes, Dr. Grace, who else? Grace told the answer. I thought Shubham told. No, Grace told. Penicillin prophylaxis. We all know that we have benzathine penicillin. Yes, exactly. We have benzathine penicillin, the injection. How do you give, IV or subcutaneous? Anyone, very quick answers please. How do you give benzathine penicillin? Every 21 days? Yes, yes, yes. Hanji, hanji. So do good. Do you give intravenous or do you give subcutaneous? What do you think, guys? Can you answer in the comment section, please? So basically, yes, beautiful. The answer is neither intravenous nor subcutaneous. You give intramuscular. Okay, you give what? You give intra. Yes, exactly. You give intramuscular. Very beautiful answer. IM is the answer. Exactly. बहुत बढ़िया. Next question, please. Yeah. Of course, we have to do your surgery. That is a mitral valve surgery. And nice question. Exactly. Should we use prosthetic valve or repair the injured muscle? मम्मा दरवाजा बंद करना, मेरा ऑस्कर खोल के चला गया. So that's a good question. I have a doubt. So if you are the surgeon, so exactly. अमृत ने बड़ा अच्छा, अमृत ने बड़ा आजकल बहुत अच्छे आंसर कर रहे हो तुम लोग, पता है, बहुत अच्छे. Like frankly telling you, your level of intellect has actually increased. Osama's intellect was the first one who got increased. Then Shubhangi answering very nice, and even Karan is answering good. Amrit answer, Shubham, Manish, bang on, very good, very good. That's right. हाँ, सो हाँ, करण कह रहा है कल ही बताया था आपने, कल ही बताया था, बहुत अच्छी बात है, पर याद आधों को रहता है ना, बीमारी ये भी तो है. दैट्स व्हाट. Okay, Dr. Amrit, you are the surgeon on call. I have a doubt. For my daughter, you are doing a prosthetic valve surgery. तो किस तरह की valve use करेंगे आप? Should we use a prosthetic? Will you use a prosthetic valve or you will repair the injured muscle? We have various. कहाँ चला गया? Yeah, we have various types of prosthetic valves, sir. This is the various prosthetic valve. We have a mesh repair also. So which one? Will you use a fresh prosthetic valve or will you repair the injured muscle? Very good, very good. Karan says he will repair the injured muscle. Very nice, very nice. Sushmita says that she will repair the injured muscle. Okay, anyone? Okay, Swaraj says repair. सबके खूबसूरत नाम, $1 million names I would like. Pandey says he will repair the muscle. Suman says he will repair the muscle. Karan says he will repair the muscle. Sushmita says they will repair the muscle. Very good, very good. Why very good? Because the answer is you don't repair the muscle. Rheumatic valves are difficult to repair. So prosthetic valve is better. Please write on your forehead. That's the best answer. Okay, हाँ जी, अच्छा, एक को लेके 25,000 और लोग शुरू हो गए. हाँ, रिपेयर 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 तुम कराओ अपने दिमाग का. ठीक है. You, one thing we need. Yes, you're right. Repair is right. What you should, brain you should get repaired. Get your brains repaired. Can we please have 10 almonds per day? Number one. Can we please have 1 spoon of honey before going to gym? It's good for health and it will make your throat nice. And also, I think apricot is very nice. It's good for health and very hormonal levels also is nice. Okay. Hmm. That is why. So the best answer is that's only the rheumatic valves are now. Will you remember this forever? That in a case, what will you remember? In a case of rheumatic heart disease, which the patient obviously has to go a mitral valve surgery, but that surgery we will use a prosthetic valves. We're not gonna we're not gonna repair the muscle. Why, doctor? Why will you not repair? They are difficult to repair. The injury is too much to the muscle. Muscle damage is too much. So that's why we're not gonna repair them. We will use a brand new fresh prosthetic valve. मम्मा दरवाजा बंद करना मेरा. So patient with prosthetic valve may need long-term anticoagulants naturally, because once you use the prosthetic valve, it might bleed out and all that. So anticoagulants are like something which is like naturally in general you need long-term anticoagulants if you use a prosthetic valve. Finish. Ooh, that finishes with beautiful class. That finishes beautiful class. Okay, yeah. Did you understand this much? Yes or no? Okay, that finishes this beautiful cardiology sessions of some 24 videos of cardiology, and that's amazing. Did you understand something? Yes or yes? Yes. Karan says, sir, गलती करेगा इंडिया तो तभी तो जीतेगा इंडिया, लर्न करेगा इंडिया. Yes, brother, that I'm really happy that you do mistakes. I always tell you, do lot of mistakes. Why? Mistakes are proof. Mistakes are proof. What? That you are trying. Mistakes are proof that you are trying. Very, very important. Mistakes are proof that you are trying. Okay, that's very important. मम्मा दरवाजा बंद करना मेरा. कोई नहीं सुनता इस घर में मेरी कोई नहीं सुन सकता. वहां के रखा है लोगों ने. Okay, cute. Great. Yeah. Okay. Orion says, please once quick revision. Yeah, I would love to. Actually, that's a good idea. Good you thought about it. In this beautiful $1,000,000 class, first you hear a voice known as Dr. Anand, and you hear this, watch this $1,000,000 face. Who is Dr. Anand? Okay. In this class, what did you learn? Let's have a quick recap. In this class, we learned that you cannot see your reflection in boiling water. Neither you can see the truth when you are angry. So we learned that we should not be angry. Peace of mind and calm mind is best. Then also we learned that rheumatic heart disease, it is a sequelae of acute rheumatic fever. And the most commonly involved is the mnemonic is MAT, M-A-T, mitral, aortic, and tricuspid. And in all these three places, regurgitation is the thought of choice. And mitral regurge is very common. Then also we understood in the hemodynamics of mitral regurge that mitral regurgitation, it will lead to the leak of the blood in the left atrium, and obviously it will happen in systole, because when left ventricle will systole, will contract, and only the leak of the blood will be there in the left atrium. So this happens in systole, and in the diastole, blood can quietly again freely pass across the mitral valve. Then also we understood one basic part that half of the blood is pushing back, but half of the blood is going again forward also. That's why the left atrial pressure increases, but it drops during the diastole. Okay, continuously left atrial pressure is not increasing. If I would have said mitral stenosis or a severe mitral stenosis, or even mitral stenosis means block, right? So in a case of mitral stenosis, then left atrial pressure would have been continuously increased. But in a case of mitral regurg, sometimes when there is a backflow, then the left atrial pressure will increase. But when there's a diastole down, then blood will come back quietly, which has gone up, right? कितना मजा आ रहा है पढ़ाने में. Like I can picture out like that. So that's why I can appreciate one point, that the mean arterial pressure will remain slightly it will be raised, and once the left atrial pressure will be slightly raised, so I can say pulmonary venous pressure also be slightly raised. So slightly raised means that there will be no features of pulmonary congestion, no features of left ventricular failure, no features of left pulmonary arterial kind of congestion. Basically, this part is over. Also, we understood that the left, as the blood is going back to the left atrium, left atrial hypertrophy is seen, and the blood is going from the left ventricle, it is going back to the aorta, but these transitions are happening so fast that the left ventricle outflow kind of affected, like left ventricular will be in stress, kind of leading to left ventricular hypertrophy. So you will see left atrial hypertrophy, and also you will see left ventricular hypertrophy, both in a case of mitral regurgitation. And also I ask you that the blood can go from the mitral from the left ventricle to where all. Then I told you there are two outputs, one is backward and one is forward exit. That leads to very important kind of a pulse, and that pulse is known as, very importantly, very beautiful, remember, we have something known as water hammer pulse. There's a water hammer pulse you see in a case of mitral regurgitation. In the clinical feature, the patient will have an increasing resting heart rate to maintain the adequate cardiac output. And also cardiac at apex, very important, it will move downward and outward. Then also the second heart sound, as everyone knows, that A2 closes early than P2 normally. Normally, A2 closes early than P2 in a case of second heart sound, but now in a mitral regurgitation, half of the blood from the left ventricle is going back to the left atrium and half is going from the left ventricle to the aorta. So aorta is now closing more early than P2. A2 is closing more early than P2. So this is known as wide variable split of S2, that you should know. Then also we understood the treatment. Of course, if the patient is landing up into failure, then digoxin, furosemide, spironolactone and all that. Then also, yeah, we understood that the penicillin prophylaxis is good. Then also mitral valve surgery is nice option, but make sure you use the prosthetic valve, okay? Because the injured muscles are not good to repair. Also, make sure the patient is on anticoagulants. And yes, yeah, exactly. Yeah, perfect. And yeah, and that finishes this class. I will ask you the 5 random questions, but a quick motivating quote which is important. If there is light in the soul, if there is light in the soul, there will be beauty in the person. If there is light in the soul, there will be beauty in the person. If you are positive from inside, your beauty will shine from outside. If you are happy from inside, you will shine from outside. If you have that spark in you, you will shine from outside. If you have that desire of doing something amazing, you will spark from outside. If you wanna at least feel to be positive from inside, you will look positive from outside. And if you think that everything will make sense by the end of the journey, you will be positive from outside. Okay, so has everyone understood this much? Yes or yes, yes. Yes, exactly. Okay, yeah, okay. Yeah. Someone is right. Yes, yes. Karan says 5 random questions. Yes. So the random questions for this class are, I need to ask you some different crazy questions. Okay. Mm, hmm, okay, tough questions. What is the gene mutation in Treacher-Collins syndrome? What is the gene mutation in Treacher-Collins syndrome? Can anyone answer in the comment section? Question number one. What is the gene mutation in Treacher-Collins syndrome? Hanji, what do you think? Faizan says, thank you, sir. Maza aa gaya. Thanks, brother. I'm really happy that you're liking it, bro. Hanji, what is the gene mutation in Treacher-Collins syndrome? Shubham, शुभांगी, ओसामा, मनीष, करण, अमृत, हेलो। बेटा जान से मार दूंगा अगर रिप्लाई नहीं किया तो। थैंक गॉड, या। So yeah, I'll write the name also who told the right answer. Shubham told the first answer, so he said TCOF1. Yes, that's right. TCOF1 gene mutation is seen in Treacher-Collins syndrome. The first answer given was definitely by Shubham. Let's see the second question. The second question I have, okay, second question. Okay, should I ask a tough one? Which is the most commonest complication of chickenpox? Which is the most commonest complication of chickenpox? Can you please tell me which is the most commonest complication of chickenpox? Anyone? Which is the most commonest complication? Actually, okay, okay, okay. Randomly, I just got this idea. Okay, if whosoever wins the highest marks, rupees 50. Right now, I will Paytm you rupees 50. If you just tell me these 5, 6 important questions. What is the most commonest complication of chickenpox? I still have not got the answer. I have no idea. Okay, Osama says aseptic meningitis. Okay. Okay. Again, Shubham has the best answer. Shubham, you are winning. That's good. I'm happy. Yeah, secondary bacterial infections. Secondary bacterial infections. True. Next question. Okay, we'll do that. Okay, that's a good idea, no? In the end of the class, okay, not every day 50 rupees, not every day. So मेरा bank balance खत्म हो जाएगा. But someday we will try to have some prize money also, like a random thing. Okay, Shubham is winning. Let's see if you can answer anyone. Okay, next question. RS, CVS, CNS. Biventricular hypertrophy. biventricular hypertrophy is commonly associated with which syndrome? Which, not syndrome, which congenital heart disease? Biventricular hypertrophy is associated with which heart disease? Which congenital heart you can think of? Anyone? Biventricular hypertrophy. हाँ पता है, शुभम कह रहा है, I told already. तेरा नाम लिख दिया, अंधे देख, नाम देख अपना, जीत रहा तू 50 रुपए. हाँ जी बताओ. Biventricular hypertrophy. This was the question I asked in the recent cardio exam. Let's see. Up it says PDA. Okay. Suman, Grace, biventricular. Epstein. Okay. Again, that's crazy, bro. Shubham, कौवा खा के आया क्या? Nice. So Shubham again told a very beautiful answer. Truncus arteriosus. Truncus arteriosus, you will see a biventricular hypertrophy. That's very well true actually. Truncus arteriosus, you will see a body called biventricular hypertrophy. I agree with you. Okay, next question. Are you guys enjoying this quiz? Yes or yes, yes. Please let me know. गलती से मिस्टेक की है तूने? नहीं की तूने. Okay. I will ask you 6 questions, okay? I will ask total 6 questions. Let's see now if the Shubham is a fourth question. If he says yes, right answer, then he anyhow wins. Let's see now. Okay, question number 4. Okay, RS, CVS, CN. Okay, yes. Okay, 1 second. Okay. How do you diagnose a case of tracheoesophageal fistula? How do you diagnose a case of tracheoesophageal fistula? What is the best diagnostic investigation or diagnostic point you can tell me for diagnosing a case of tracheoesophageal fistula? Like, what is the best answer you can give me? Your time starts now. कितना मजा आ रहा है ना, ऐसा लग रहा है जैसे हम बातें कर रहे हैं. ऐसा लग रहा है ये क्लास, it's like the class is not going on. We are in another level of dreams and we are just talking. Today I'm too relaxed. Actually, maybe I'm talking like this. Is my voice audible? Because I have a throat issue. That's why I'm little very close to the camera, and my face also is like very, as if literally I'm sitting in your house only. That much like that I am. Okay. Karan says J. J क्या होता है bro? What is J? I don't know what is J. Ultrasound. Okay. Yeah, actually, 1 second. Okay, 1 second. Yeah, frankly, which as an examiner, Faizan Raza told the best answer that you will get a X-ray chest done with NG tube in situ. You will get X-ray chest done with NG tube in situ. That's the best answer told by who? Told by apna Faizan Raza. Okay, done. Okay, next question. Question number 5. Question 5. Let me think. Frothy diarrhea. Frothy diarrhea with perianal excoriation. What is the best diagnosis? Frothy diarrhea with perianal excoriation. Doctor, my baby passing what you called very frothy stools, and the potty side is fully red and fully excoriated. He cry when he pass potty. The best answer is dash. What do you think? Okay, fine. What's the best answer? Okay. Right now, Shubham. Acha, Shubham only winning, no? Right now, actually, yeah. And anytime I can alter the quiz. Okay. Later, don't cry and don't run here and there. Oh, आपने 6 question बोले थे. The quiz, participate, enjoy. That's the journey. I think yes. Who told the right? Oh, Amrit has told. Actually, Shubham is also right. Shubham, very good. I'm surprised, Shubham, that you're answering like this is great. But your brother Amrit has answered first. Amrit has told the right answer that lactose intolerance. Frothy diarrhea with perianal excoriation is undoubtedly lactose intolerance. Okay, great. Okay, great. Okay, next. Question number 6. In each 100 ml of breast milk, in each 100 ml of breast milk, how much gram of lactose is present? In each 100 ml of breast milk, how much gram of lactose is present? Yes, Rakesh, okay, Monimala, Karan, Osama. In each, this is the last question. In each 100 ml of breast milk, how much gram of lactose is present? What do you think, guys? What do you think? Yes, Karan? Yeah. Yeah. Osama has the best answer. That's very good. Osama has the best answer. Each 100 ml of breast milk contains 7.4 gram of lactose. Each 100 ml of breast milk contains 7.4 gram of lactose, and the predominant carbohydrate present in the breast milk is lactose, and that is why the breast milk is very sweet. अगर माँ का दूध पिया हो तो वो बहुत मीठा होता है. It's very sweet. Okay, because it has a predominant carbohydrate, nothing which is known as lactose, and 7.4 and 4.7, each 100 ml of breast milk contains 7.4 gram of lactose, and cow's milk 4.7. That you should know. Yes, perfect. So can we please declare the winner? Hello, can you please declare the winner? Who is the winner? Who is the winner? Yes, in this beautiful competition we had Shubham 1, or kind Shubham 2, Shubham 3, then Faizan Raza, Osama, and Amrit. So can we please congratulate our Shubham? Shubham has told the right answer. Shubham. Yes, Shubham has told the right answer. Very good. Can we please congratulate Dr. Shubham? So beautiful. Our, yes, very good. Congratulations, Dr. Shubham. बेटा जीत गया तू देख ले. Very good. Very beautiful answer. Very beautiful participation. Thank you so much, everyone, for this wonderful evening. See you tomorrow again at 8:30 p.m. Tomorrow we have the class on our app. If you're a newcomer, please download Pediatrics by Dr. Anand for the iOS and Android. If you're not able to find, my mobile number is 9999897081. You can just put me a message. I will add you in the respective group. यस या फैजान कह रहा है आग लगा दी ब्रो, आग लगा दी. दैट्स ट्रू. वो है ना जो लगा देंगे स्टेज पर आग. अरे अरे कहाँ है आग? अरे बाबा जलवे की आग. Thank you so much, guys. I had a wonderful time. I was very comfortable talking to you. I hope you had a great time talking to me. Shubham, आजा WhatsApp पे 50 rupees ले जा. And that's a beautiful point. You deserve it, bro. And I'm really proud of you. See, like, it's very good. Very good, actually. Yes, exactly. Okay. Yeah, Monimala says, sir, the app is not open from two devices. So you wanted them to open from 2, 3 devices. That's very cute. Take 2 numbers, open from 2 devices. As simple as that. Okay. Okay. Please take care. Please take care, and bye bye. See you tomorrow 8:30 p.m. Tomorrow I'm planning to start CNS, and neurosarcosis will be the topic of choice. Important topics of CNS. Let's finish them. And thank you. Take care. Bye bye.